look at the health system as a health system, not as multiple health systems, which is really what a lot of it is sometimes, I think we can actually deal with the complexity that is out there. But I want to actually push the next level, which is more open data, where we can actually provide de-identified, anonymous data to a broader sector so we can drive research and other policy conversations. We still need the courage to ask the right questions. We need the courage to actually change behaviours out there. Change from that provider-driven system to a more consumer-driven system. Give the system permission to take risks, permission to actually try different things, and permission sometimes to fail. Because if you don't do that, you actually don't get the change that's actually needed, I believe, in delivering quality healthcare.
We have moved on from wanting to incentivize the adoption and use of health IT, which was really what the Meaningful Use program was about, wanting to incentivize the better care for patients and populations, and health IT is one of the critical tools that we have to make that happen. And so we have to help health IT evolve to be that tool and not be the end game. We have a role to play in the federal government, but we do not want to do this alone, nor should we do this alone. To be sustainable, to be fast, to be innovative, the private sector has got to partner with us, and so that's really my call to this group.
The payment system is going to drive provider organizations to need and want to aggregate data and aggregate workflow, because they're going to have to get more efficient, and they're going to do that through aggregation of data and the workflow on top of that.
Trying to make that convenience visible to the general marketplace will create the demand that then will lead to freeing the data, the need to free the data, the need to aggregate data from not just clinical data, claims data, but consumer experience data, other forms of data that exist out there.
Let's make it easy. Let's make it so that they can go on the app, find a location where they could go and do a health check, book the online appointments through the application, all done in a central dashboard, right? And it's going to be mobile.
It doesn't matter, what part of the world you're sitting in, you're residing in, but that you end up bumping into the same, if not identical, very, very similar problems.
A troubling thing is when you survey patients and ask them, patients who have chronic illnesses, how often have they been asked about the impact of their illness on their ability to function or do the things they need to do in their daily life? 80% of patients say they've never been asked about that in the process of care delivery, because it just hasn't been part of what clinicians think about as their job.
Interoperability amongst various data sets is probably the nearest term opportunity we have. And so frankly, if we can solve that, then the need to create these large pools of data, even under the circumstances you mentioned, I think begins to go away. So let the data reside where they are and let us access it in a responsible manner in order to create the value we need.